Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cancer and pregnancy. Introduction. Cancer during pregnancy is rare, but it does happen. Cancer itself rarely harms the baby, and some cancer treatments are safe during pregnancy. Your options for cancer treatment will depend on how far along you are in your pregnancy, as well as the type, size, and stage of the cancer. You and your healthcare provider will work together to find the best treatment. This program explains cancer and pregnancy. It discusses how pregnancy affects a woman's treatment options for cancer. Cancer. The body is made up of small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing. These extra cells cause an abnormal growth. The growth is called a tumor. If the tumor does not invade tissues and body parts, it is called a benign tumor. It is also called a non-cancerous growth. Benign tumors are often not life-threatening. A malignant tumor invades nearby tissues and body parts. It is also called cancer. Cancer cells are able to spread to different parts of the body. They can spread through blood vessels and lymph channels. Lymph is a clear fluid made by the body that drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that moves from one tissue to other body parts is known as metastatic cancer. For example, a lung tumor may grow through the lung's outer layer. It can then grow into nearby tissues over time. Cancers in the body are given names. These names depend on where the cancer started. Cancer that begins in the breast will always be called breast cancer, even if it spreads to other places. Cancer and pregnancy. The most common cancers in pregnancy are breast cancer, cervical cancer, lymphoma, melanoma. Breast cancer is the type of cancer found most often in pregnant women. About 1 out of 3,000 women who are pregnant are diagnosed with breast cancer. Another type of cancer that women can get is called a gestational trophoblastic tumor. It happens when a fertilized egg doesn't become a fetus. This cancer is rare. A gestational trophoblastic tumor may not be easily found. In its early stages, it may look like a normal pregnancy. You should see your healthcare provider if you have vaginal bleeding or if your baby hasn't moved at the expected time. A pregnant woman who has cancer can still give birth to a healthy baby. Cancer usually does not affect the fetus, but some cancers may spread to the placenta. The placenta is an organ that develops during pregnancy. It feeds and nourishes the fetus. The chance for recovery from cancer for a pregnant woman is usually the same as a woman who is not pregnant, but the cancer could spread or cause problems if treatment is postponed. The hormones made by a woman's body while she is pregnant may increase the spread of certain types of cancer. Talk to your healthcare provider about how your pregnancy may affect your specific cancer. Cancer cells cannot pass to a baby through breast milk. But healthcare providers recommend that women who are being treated for cancer do not breastfeed. Chemotherapy and radiation treatments can be harmful to a baby. Chemotherapy can enter the breast milk and enter the baby's body. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Diagnosis. A cancer diagnosis is made based on tests that depend on your specific symptoms. Your healthcare provider will ask you questions about your personal and family medical history. Your healthcare provider will perform a physical exam to feel for tumors and look for other changes that may be signs of cancer. Laboratory tests can help your healthcare provider find cancer. These include blood and urine tests. Imaging tests may also be done. Imaging tests let your provider look inside your body without an incision. Some of these tests have risks and can be harmful during pregnancy. X-rays use a low dose of radiation that is generally considered safe for the fetus. Even so, the fetus should be shielded with lead when any type of X-rays are done. This is a precaution for all types of X-rays, including CT scans. Computed tomography scans or CT scans are similar to X-rays. They use ionizing radiation. CT scans are much more accurate than X-rays at outlining internal structures. They can help diagnose and stage cancer. Head and chest CT scans don't expose the fetus to radiation. A lead shield is usually worn. They are generally safe for pregnant women. Other diagnostic tests are also considered safe during pregnancy because they don't use ionizing radiation. These include biopsy, magnetic resonance imaging or MRI, ultrasound. Some symptoms of cancer are also normally experienced by women during pregnancy. These include bloating, headaches, swollen and tender breasts. These can make it harder to identify cancer when a woman is pregnant. Sometimes tests associated with pregnancy can detect cancer. For example, a Pap test done as part of prenatal care can reveal cervical cancer. To detect breast cancer, pregnant women should examine their breasts. Women should also receive clinical breast examinations as part of prenatal and postnatal care. Methods used to stage cancer can be changed to make them safer for the baby. Standard methods for giving imaging scans can be adjusted so that the baby is exposed to less radiation. Treatment. The best way to treat cancer during pregnancy depends on several factors, including what kind of cancer the woman has and where it is located, how big the tumor is and whether the cancer has spread, the overall health of the patient. Treatment for cancer may include surgery, radiation therapy, chemotherapy, targeted therapy, hormonal therapy, immunotherapy. A combination of these treatments may be used. Surgery for cancer is generally considered safe for the fetus, but this depends on where the cancer is located. In most cases, the tumor and some surrounding tissue is taken out. Removing nearby tissue may help prevent the tumor from growing back. The surgeon may also remove some nearby lymph nodes. Radiation therapy is a cancer treatment that uses high-energy X-rays or other types of radiation to kill cancer cells or keep them from growing. The way the radiation therapy is given depends on the type and stage of the cancer being treated. Some types of radiation therapy can cause harm to the fetus. Chemotherapy may be given in the bloodstream through an IV or taken by mouth. It can also be placed in a specific area of the body. The type used depends on the type and stage of the cancer being treated. Chemotherapy and radiation therapy cannot be done during the first trimester of a pregnancy. These treatments raise the risk of birth defects. Some types are considered safe during the second and third trimesters. Ending the pregnancy may be recommended in some cases of advanced or aggressive cancer. Targeted therapy targets specific differences in cancer cells to try and prevent the cells from growing and spreading. Hormonal therapy adjusts the level of hormones in the body to help fight cancer. Hormones are chemical messengers that control body functions. Immunotherapy or biological therapy fights cancer by boosting your body's immune system. It may help your body kill cancer cells, slow down their growth, or prevent them from spreading. Ask your healthcare provider about the risks and benefits of targeted therapy, hormonal therapy, or immunotherapy during pregnancy for your type of cancer. For breast cancer, other treatment options may include breast biopsy, lymph node removal, mastectomy. Many people who have cancer or who have been treated for cancer develop symptoms or side effects that affect their quality of life. Care given to help patients cope with these symptoms or side effects is called palliative or supportive care. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Cancer during pregnancy is rare, but it does happen. Cancer itself rarely harms the baby, and some cancer treatments are safe during pregnancy. The most common cancers in pregnancy are breast cancer, cervical cancer, lymphoma, melanoma. A pregnant woman who has cancer can still give birth to a healthy baby. Cancer rarely affects the growing fetus, but some cancers may spread to the placenta. The chance for recovery from cancer for a pregnant woman is usually the same as a woman who is not pregnant, but the cancer could spread or cause problems if not treated quickly. The best way to treat cancer during pregnancy depends on several factors, including what kind of cancer the woman has and where it is located, how big the tumor is and whether the cancer has spread, the overall health of the patient. Treatment for cancer may include surgery, radiation therapy, chemotherapy, targeted therapy, hormonal therapy, immunotherapy. A combination of these treatments may be used. Thank you for using Explain.